Well, hello everyone. It's been almost 12 days since I've done my bone marrow biopsy, and I waited for the pain to go away. And I want to tell you my own experience if you're going to do this test. Um, First of all, I've been never been operated on. The only time that I was been in the hospital is for a endoscopy, and that was like a full anesthesia. Um, I didn't feel anything. I didn't feel any pain at all during this operation. Um, Over here, I don't know if it's a Florida law or what, or it's a federal law in general. But if you want to do this full anesthesia, doing this bone marrow biopsy, you have to have two anesthesia doctors or specialists, if you want to call them. It's a law over here in Florida. So mine was done in the clinic. It was not a full anesthesia, just a just the right where the doctor insert the needle. What I want to suggest is I don't want you to watch any video. I suggest you don't watch any other videos. There are a couple of other patients you're gonna see on YouTube that screaming and it's that's a mistake that I done is I watched those patients in the operation room, and it made me more frightened. Let's say that. I mean, I'm pretty like a tough guy, but pain is relative. But fear is universal. I mean, being a sick person is not funny, and I've been going through a lot of tests in the past 3 months. My doctors are trying to rule out if I have MGOS or amyloidosis or multiple myeloma. I mean, sometimes it's like to be sick, it just happens all of a sudden. I'm 48. I don't smoke, I don't drink, practice regularly, try to eat healthy, but just all of a sudden I start to feel very tired and I just abnormal fatigue. If I were to drive for like 30 minutes, I have to pull out because I really need to take a nap. It was just like, it was a shock to everybody that you think that you're doing the right thing, but all of a sudden you find out like you're really sick. One day before the operation, I asked the nurse if there's any precautions that I should take, and she said no, not really. And well, it wasn't the case with me. So I suggest you have someone drive you over there, and also of course pick you up. Please take the day off, okay? That was like another mistake that I done. Okay, so one day I watched the test as I mentioned, and I watched like also the tools that the doctor used, and please don't do that. Okay, just go over there and just let's say, I don't want to say have fun, but just make yourself like surprised, let's say that. Okay, I don't like going to hospitals. It make me feel so depressed, although that I give you like a sense that you're a very well human being, that you see all those sick people out there and you walk on your feet and you do a lot of things that they cannot do. So I walked into the clinic, and what you want to do is you want to wear like loose clothing, like sport clothing, because somehow you don't wear like pants with hoses or something like that. Okay, you want to wear clothing that you make you feel very comfortable. Okay, and as soon as I got into the room, I looked at the clinic and other tools, and I was more frightened. So a doctor came and gave me the anesthesia shot, and I guess I waited like 5 minutes or so until it started to kick in, and I guess it took him about 4 to 5 minutes for the whole operation. But the most painful part is you're gonna feel the needle moving between your bones. It's absolutely uncomfortable. Um, what I did is just like I didn't cry, but I had a pillow. Just like I have to grab on it very hard, just like to absorb the pain. It's okay. Just relieve your pain. Um, Women, of course, don't like to cry, but I mean, I didn't cry or something like that, but it was absolutely uncomfortable feeling. Let's say that. Okay. Um, so after the doctor finished this, he told me like to just lay on the bench, just stay there for like 5-10 minutes or whatever it take, and the nurse is gonna stay there. The nurse, I mean, she stayed there, and I looked at the sample that she took. It looks exactly. I don't know if you ever look at the bone marrow of a cow or an animal or something like that, but it's not an actual blood. It's kind of like mix of white and brown and red color. So that also like make me feel sick. Let's say that. Okay. Um, I started to move myself. It was absolutely again not a very comfortable walking. I mean, you're gonna start to limp. You're gonna feel the pain on the side where he inserted the needle. I could barely stand up. I slowly I start to walk, and but definitely I was limping and walking like a 90 years old guy. He did not prescribe a painkiller. I'm not a big fan of any taking any medicine, and always try to seek alternative medicine. Um, Almost like 5-6 months ago, I had a TMJ, and for those who had dentist pain, you know what does that mean. So I used like some anti-inflammatory and painkillers, which was the turmeric. We're lucky enough here. I live in Tampa, and we have a lot of Asian stores here that they sell the actual root. And what I do is I juice it. It's more powerful than taking just the turmeric pills, the 400 milligram or so. I also took some magnesium, about 800 milligram, because that will work as a muscle relaxant. And also, well, after one day, the doctor's gonna put kind of like a bandage right where he inserted the needle, and it's like a big one. He told me like not to take a shower for 24 hours, just leave it there, and remove it after 24 hours. So after the one day, I did like a hot pepper patch. What you do is like you mix hot pepper, habanero, whatever you can find, and then do some sort of like a batch. If you can take that burning feeling, then it's gonna absorb a lot of pain. I made a big mistake of not taking the day off. Okay, I run my business, and I had to do some work that day, but I should have planned it that I do it the next day. So do yourself a favor, take the day off. Okay. Because I think that's the main reason that I felt the pain for almost 8 to 9 days. It's not easy to forget. Okay, so I guess that's another reason that the pain lasted longer. Every time I remember the picture of the needle, it just make me feel like the needle is still inside my back. It's just it's just absolutely discomfortable situation. If you look at like where even like the doctor inserted the needle, it's not like a regular small shot like where we take like a blood sample or something like that. It's a little bit big, and when you take a shot and you look at it like where the spot the doctor took it, it's just not funny, and it made me always like remember the pain. But again, the pain lasted with me about 8-9 days, and it felt again like the needle is still inside my bone. But luckily, again, after almost like I mentioned 8-9 days, the pain went away. Anyhow, so good luck with your tests. Feel free to let it out, okay? And whatever results you get, it's going to be good. All right, I'll see you in another video. Thank you.